Lainey, do I have your permission to use you for my therapeutic interventions 2 class?
Yes.
So we are doing stretches for a tight calf. The first one I'll have you do is the standing calf stretch. This is targeting the gastrocnemius, and then it's stretching the soleus as well. So the patient will be facing the wall, and you'll have your about like an arm length away, and then you'll place your hands flat on the wall at shoulder height for support. Step the left foot back, keeping it straight and pressing the heel into the ground. The right knee should be slightly bent with majority of the weight on the front foot. And then lean slightly forward when doing this. Hold it for 20 to 30 seconds and then switch feet. And I'll time it for you.
Perfect.
For time's sake, I'll go ahead and have her switch. Okay, you can rest. The next stretch is similar to this one. The next stretch is the gastrocnemius stretch. It's similar to the standing calf stretch, but this time the back knee is bent. So you'll lean forward, keeping both heels flat on the ground, and put your left leg back and bend the left knee, and then keep the right one up a bit, and keep that one straight and hold for 20 to 30 seconds, and then switch.
Like this?
Yes. And then for time purposes, go ahead and switch legs. Okay, relax. The next stretch is the soleus stretch. This is targeting the soleus muscle. The patient will assume in a lunge position with the left foot forward and the right knee on the ground. I will then instruct her to have her weight forward, keeping the right heel on the ground until she feels a stretch in her lower calf. She'll hold this for 20 to 30 seconds, and then we'll switch to the other leg. And go ahead and switch. And switch. Next is the seated calf stretch. This is targeting the gastrocnemius and a little bit of the Achilles tendon. She will sit on a table or the ground with either a towel or a resistant band. I'm using a resistance band. She'll loop it around the ball of her foot as she has here, and she'll keep the right leg extended and gently pull the band or towel towards her until she feels a stretch in the calf. And she'll hold it for 20 to 30 seconds and then switch. And I'm just gonna stop here. Now you can do a myofascial release on the patient. They can do it themselves with a lacrosse ball, but I do not have a lacrosse ball. So you find in between the soleus and the 2 gastroc heads, and you'll push down with your thumb until they feel the pain. And then once the pain diminishes, you can press down a little bit harder. And maybe do about a couple, 30 seconds, 60 seconds, and then let go, relax, and you can move to the other leg as well. Some special considerations is monitoring, giving the patient's history of breast cancer and extended periods, times of standing. It's essential to monitor for any signs of discomfort or strain during the stretches. Encourage her to communicate any discomfort immediately. Gradually progress her, starting with gentle stretches, and gradually increases intensity if appropriate. Avoid aggressive stretching as it may exacerbate any existing issues. Hydration is important for her as she's on her feet a lot. Proper hydration supports muscle function and flexibility. And if tighten persists or worsens despite stretching or any of like the myofascial release, refer her back to her doctor to get a further evaluation and guidance if it's coming from like her breast cancer history. But incorporating these stretches into her routine, it can alleviate the calf tightness and maintain flexibility, potentially reducing discomfort associated with her job demands.